So now we're going to start the discussion about the CSF and the ventricles. Okay. So now what is CSF? See, CSF is not the ultrafiltrate from the blood. So it is not the ultrafiltrate from the blood, which is actively secreted by choroid plexus, mainly secreted by the choroid plexus. Okay. Now the choroid plexus of the lateral ventricle and the third ventricle, it is coming from choroidal arteries, anterior and posterior choroidal arteries, anterior and posterior choroidal arteries. The choroid plexus of fourth ventricle is coming from pica greater than ica, posterior inferior cerebellar artery greater than anterior inferior cerebellar artery. Okay, so the CSF coming from secreted by choroid plexus, and that choroid plexus is coming from choroidal arteries for lateral and third ventricle. Which choroidal artery? Anterior and posterior choroidal artery. Now the choroid plexus of fourth ventricle is coming from pica greater than ica. Just remember this. Apart from choroid plexus, CSF also secreted by the ependymal cells lining the ventricles and the brain substance through the perivascular space. This is all they won't ask you. For the completion sake, I'm saying CSF is also secreted by ependymal cells and the brain substance through perivascular space. Now we're going to draw the flow chart for the circulation of CSF. So please write the heading, circulation of CSF. Now CSF from the lateral ventricle come to third ventricle through foramen of Monro. So through foramen of Monro, CSF from the lateral ventricle come to third ventricle. Okay. Now CSF from the third ventricle come to fourth ventricle through cerebral aqueduct of Sylvius. Cerebral aqueduct of Sylvius. Cerebral aqueduct of Sylvius. Okay. Now CSF from the fourth ventricle, the very minimal amount of CSF will go to the central canal of the spinal cord. The majority of the CSF go to subarachnoid space. Majority of the CSF go to subarachnoid space. Now CSF from the fourth ventricle, which go to cisterna magna. Cisterna magna. See, cisterna means the enlarged subarachnoid space are called cisterns. Now we have one large cistern that is called cisterna magna, which is also known as cerebello-medullary cistern, which is also known as cerebello-medullary cistern. Again, name itself you have a clue. The cistern is present between cerebellum and medulla. And the CSF from the fourth ventricle also go to cerebello-pontine cistern. Cerebello-pontine cistern. Now through which opening, sir? Now we have foramen magentae. Now foramen magentae, through foramen magentae, the CSF from the fourth ventricle go to cisterna magna. Now CSF from the fourth ventricle go to cerebello-pontine cistern through foramen luschka. Now foramen luschka is called lateral aperture. Now how many lateral aperture we have? We have two lateral aperture and we have one median aperture. So foramen magentae is called median aperture and we have only one median aperture, foramen magentae. Two lateral aperture, foramen luschka. The foramen magentae and foramen luschka, they are present in inferior medullary velum. It is present in inferior medullary velum. See, velum means sheet. The inferior medullary velum and the superior medullary velum, they form the roof of the fourth ventricle. I will show you. Okay, so meanwhile, please remember the inferior medullary velum. In the inferior medullary velum, we have three apertures. What are those? Foramen magentae and two foramen luschka. Okay, right. Now CSF from the cistern, that is subarachnoid space, which in turn drain into dural venous sinus. Okay, through arachnoid villi, through arachnoid villi. So through arachnoid villi, CSF from the subarachnoid space drain into dural venous sinus. Mainly, which one, sir? Mainly superior sagittal sinus. Mainly superior sagittal sinus. Okay? Any doubt? No. So this is about the circulation of CSF. Now we have diagram. We'll see the diagram and then we proceed. See here. Now this is CSF in the lateral ventricle. So CSF in the lateral ventricle through foramen of Monro come to third ventricle. Now from third ventricle through cerebral aqueduct of Sylvius come to fourth ventricle. Now from fourth ventricle through foramen Magentae and foramen Luschka, CSF come to subarachnoid space. Okay. Now from the subarachnoid space through arachnoid villi or arachnoid granulations draining into dural venous sinus, mainly superior sagittal sinus. Okay. So now see the diagram. Now in this diagram, this is our cerebrum. Now the cerebrum, the brain, which is closely covered by the pia mater. Okay, so we will draw a line diagram and then we see. Now the line diagram, this is our brain. Now this is our pia mater. Okay. Now above the pia mater, we have arachnoid membrane. Now arachnoid membrane is having some granulations that is called arachnoid villi. And above that, we have dura. Now dura, cranial dura is having two layers. Now this is our arachnoid membrane. That is our arachnoid membrane. And this is our dura. So dura is having two layers. Now this is our meningeal layer of dura. Meningeal layer of dura. And above that is the endosteal layer of dura. Endosteal layer of dura. Now between the two layers of dura, we have a space. In the anatomy, the spaces are called sinus. So we have a sinus between the two layers of dura and the space is called dural sinus. Now this space is called dural sinus and this space contains venous blood, not artery blood, venous blood. So it is called dural venous sinus. Okay. So now I told you between our pia mater and the arachnoid membrane, we have subarachnoid space. That space is present below the arachnoid membrane, subarachnoid space, which contain CSF. So this is CSF. Now CSF from the subarachnoid space through arachnoid granulations, which is draining into dural venous sinus. So that is what we have written. Okay, CSF from the subarachnoid space to arachnoid villi and arachnoid granulations draining into dural venous sinus, mainly superior sagittal sinus. Clear? The same thing you are saying. Now this is our subarachnoid space. This is our subarachnoid space, which contain CSF. Now through the arachnoid villi and granulations, it is draining into superior sagittal sinus. Okay, right. So now we also have subdural space. Now subdural space, which is present below the dura, and the arachnoid membrane. Okay, right. Subdural space. Now the subdural space, which contains one vein. What vein? Bridging veins. So subdural space, which contains bridging veins. Shall we proceed? So now the patient is having subdural hemorrhage. That is due to involvement of vein. Which vein? Bridging veins. Now see here. So now we are seeing subdural hemorrhage. So subdural hemorrhage is the what hemorrhage? Venous hemorrhage. It is the venous hemorrhage. due to involvement of bridging veins. Now we also have epidural space. The epidural space means above the dura mater we have a space, epidural space. Now epidural space which contains artery, which artery? Middle meningeal artery. Middle meningeal artery is present. Middle meningeal artery is present in the epidural space. So epidural hemorrhage is due to middle meningeal artery. Subdural hemorrhage due to involvement of bridging veins. So epidural hemorrhage is the artery hemorrhage. Subdural hemorrhage is the venous hemorrhage. Is that clear? Right. Now in this diagram, we are seeing pterion. Now what is pterion? See, pterion is the meeting point of 4 bones. What are those? This is frontal bone. This is parietal bone. This is squamous temporal bone and the greater wing of sphenoid. The meeting point of these 4 bones are called pterion. Now what is present beneath the pterion? Now beneath the pterion, we see anterior division of middle meningeal artery. So the fracture of the pterion, which in turn affect the middle meningeal artery. The exam will ask you specifically. See, 2020 AIMS exam, we got this question. They gave this image, the structure present beneath the marked area. So answer, middle meningeal artery. The same question was repeated in 2022 INACT exam. Now, in 2022 INACT exam, the same image was given and they're asking the structure present beneath the marked area. And in that 2022 exam, they ask specifically which branch of middle meningeal artery? Which branch? Anterior branch of middle meningeal artery is present beneath the pterion. Clear? Right. So, next one. Now, in non-contrast CT, now how these hemorrhages look like? Now, in the non-contrast CT, the epidural hemorrhage, see here, it is biconvex shape. It is biconvex shape, length shape. Whereas subdural hemorrhage, see here, it is C shape or crescent shape. So epidural hemorrhage in the non-contrast CT, the shape is lens shape or biconvex shape. Okay. And the subdural hemorrhage, the shape is C shape or crescent shape. Okay. Now, in both epidural hemorrhage and subdural hemorrhage, we see lucid interval. Lucid interval, it is seen in both epidural hemorrhage and subdural hemorrhage. Okay. Now, lucid interval, it is seen in both epidural hemorrhage and subdural hemorrhage. Now, what is lucid interval? The patient is apparently normal for some period of time. The patient is having the injury. Now, immediately after the trauma or assault or injury, the patient become unconscious. Then the patient regain the consciousness, which may last for few minutes to few hours. Again, the patient lose their consciousness. So the mean period of time, he is normal, he is conscious, and that is called lucid interval. Now, lucid interval, it is seen in both epidural hemorrhage and subdural hemorrhage. So lucid interval, it is seen in, sometimes they may ask you the single best answer. In that case, please go for epidural hemorrhage greater than subdural hemorrhage. Okay, in both the conditions, using lucid interval. But the best answer is epidural hemorrhage greater than subdural hemorrhage. Clear? Yes. Now we're going to see few more applies. Now see the diagram. Now the first one, the patient is having block in the aqueduct of Sylvius, the cerebral aqueduct of Sylvius. The patient is having block. The condition is called aqueductal stenosis. The condition is called aqueductal stenosis. That is our aqueductal stenosis. Now, in the case of aqueductal stenosis, which ventricle dilated? See here. Now we have a block here. So due to aqueductal stenosis, which ventricle dilated? Very simple. Third ventricle is dilated. Okay. Right. So in the aqueductal stenosis, third ventricle is dilated. Okay. Now, please remember congenital aqueductal stenosis. Please write. Note the most common cause for congenital hydrocephalus. The most common cause for congenital hydrocephalus is congenital aqueductal stenosis. Very important. The most common cause for the congenital hydrocephalus is congenital aqueductal stenosis. Clear? Right. Now, one more applied. Atresia of foramen magentae and foramen lusca. That is seen in Dandy-Walker syndrome. So, in Dandy-Walker syndrome, please write note Dandy-Walker syndrome. Now, Dandy-Walker syndrome, you see atresia of foramen magentae and foramen lusca. Now, in Dandy-Walker syndrome, which ventricle dilated? Very good. Fourth ventricle is dilated. Fourth ventricle is dilated. Okay. So, now see the diagram. Now, this is aqueductal stenosis. Okay. There's a congenital aqueductal stenosis, and that is the most common cause for congenital hydrocephalus. And this is a Dandy-Walker syndrome. And we are seeing the atresia of foramen magentae and lusca, and fourth ventricle is dilated. Okay. So, that's all about the CSF, circulations, and the relevant applies. Now, next we're going to discuss about cisterns. Now, what is meant by cistern? The cisterns are nothing but the enlarged subarachnoid space. Enlarged subarachnoid space. Enlarged subarachnoid space. Okay. So, now how the cisterns are formed? See, I told you the pia mater which dips into every sulcus of the brain. Now, this is our pia mater. Okay. Now, outer layer, just outer to the pia mater, now we have the arachnoid membrane. So, normally we have the subarachnoid space between the arachnoid membrane and the pia mater. Now, here, now in this area, now the pia mater which dips into the sulcus, and we have the subarachnoid space and which is enlarged, and that is called cistern. Okay. So, cisterns are nothing but the enlarged subarachnoid space. Clear? Right. Now, we have 5 cisterns, and in the exam, they will ask you mainly about the content of the cistern. Now, first one, interpeduncular cistern. Now, interpeduncular cistern, now see the diagram. Now, this is the midbrain. The midbrain will be like this. Now, this is the crux cerebri or the cerebral peduncle. This is cerebral peduncle. Midbrain, cerebral peduncle. Okay, this is a midbrain. See, I am not drawing all the structures in the midbrain, just basic outline only. Midbrain, if you take a section, it will be like this. Okay. Now, very close to the brain, I told you the green color, what I am drawing now, and that is our pia mater. I told you pia mater which goes into every sulcus, dips into every sulcus of the brain. Right. So, this is our pia mater. So, this is our pia mater. Now, out of the pia mater, we have arachnoid membrane. So, this is our arachnoid membrane. So, arachnoid membrane which is not dip into the sulcus. So, now we have this subarachnoid space which is enlarged. Now, this subarachnoid space which is present between the cerebral peduncle, and that is called interpeduncular cistern. This is called interpeduncular cistern or peduncular cistern. Interpeduncular cistern. Okay. Now, interpeduncular cistern contains the posterior part of the circle of Willis. We have the posterior cerebral artery, and we also see posterior communicating artery. Posterior cerebral artery and posterior communicating artery present. Posterior communicating artery are present. Okay. Posterior cerebral artery and posterior communicating artery. That is the posterior part of circle of Willis. Okay. Right. Now, see the diagram. So, this is our, yes, peduncular cistern which contains the posterior part of circle of Willis. Fine. And we have pontine cistern. See, pontine cistern present in the ventral surface of the pons, which is present on the ventral surface of the pons, on the ventral surface of the pons. Now, which contains basilar artery, the pontine cistern, which contains basilar artery. Okay, right. Next, cisterna magna. See, cisterna magna, it is also called cerebello-medullary cistern, between cerebellum and medulla. Cerebello-medullary cistern. Now, what are the contents of cisterna magna? Vertebral artery, posterior inferior cerebellar artery, 9th nerve, 10th nerve, 11th nerve, and the 12th nerve. Last 4 cranial nerves, the vertebral artery and pica present in the cisterna magna. Next, quadrigeminal cistern. The quadrigeminal cistern, now that is present behind the midbrain. Okay. Now, on the posterior surface of the midbrain, we have 4 swellings. Now, this is superior colliculus and this is inferior colliculus. Now, these 4 swellings are called corpora quadrigemina. These 4 swellings are called corpora quadrigemina. Okay. So, corpora quadrigemina is nothing but the 4 swellings, 2 superior colliculus and 2 inferior colliculus on the posterior part of midbrain. Now, here in the corpora quadrigemina, just behind the corpora quadrigemina, we have a cistern, and that cistern is called quadrigeminal cistern. Okay, so quadrigeminal cistern, which is present just behind the corpora quadrigemina. Okay, now what are the content of the quadrigeminal cistern? The quadrigeminal cistern, which contains great cerebral vein of Galen. Great cerebral vein of Galen is present in the quadrigeminal cistern. So, quadrigeminal cistern is present just behind the corpora quadrigemina. So, which is present between the splenium of the corpus callosum, that part I marked, that is called the splenium of the corpus callosum, and this is cerebellum. So, the quadrigeminal cistern is present behind the corpora quadrigemina and also between the splenium of the corpus callosum and the cerebellum. Content great cerebral vein of Galen. Okay. Now we have one more. Cistern, that is called Sylvian cistern. So Sylvian cistern, it is present over the lateral sulcus. Now what is the content? The Sylvian cistern, which contains middle cerebral artery, and also which contains superficial middle cerebral vein, So Sylvian cistern is present over the lateral sulcus, which contains middle cerebral artery and superficial middle cerebral vein. Okay, right. That's all about the cisterns. Okay. So next, we're going to start the discussion about the lateral ventricle, third ventricle, and the fourth ventricle. So now we're going to discuss the lateral ventricle first. Now, lateral ventricle, I told you the development itself. Lateral ventricle, it is a cavity in the cerebrum, cavity in the telencephalon. Now, what are the parts of the lateral ventricle? Now, the lateral ventricle, which goes to all the lobes of cerebrum, it goes to frontal lobe, parietal lobe, temporal lobe, and the occipital lobe. So, what are the parts? Now, we have the central part, okay, anterior horn, posterior horn, and the inferior horn. Okay. Now, the central part of lateral ventricle is present in the frontal lobe, and the parietal lobe. Now, the anterior horn of lateral ventricle, which is present in the frontal lobe. Now, the posterior horn of lateral ventricle, which is present in the occipital lobe. Okay. And the inferior horn of lateral ventricle, which is present in the temporal lobe. So, this is a basic idea about the location of the different parts of lateral ventricle. Okay. Now, what is anterior side? Which lobe we have? Frontal lobe. So, anterior horn in the frontal lobe. The central part, frontal and parietal. Which lobe is posterior? Occipital lobe. Posterior horn into occipital lobe. Inferior, temporal lobe. Inferior horn, the temporal lobe. Okay, right. So now next one, the basic relation of the lateral ventricle. Now see the diagram. I told you lateral ventricle, it is a cavity in the telencephalon. Now telencephalon which give rise to cerebrum and also basal nuclei. Now caudate nucleus, it is a part of basal nuclei. So caudate nucleus derived from telencephalon, and we have a cavity in the telencephalon that is called lateral ventricle. So the point is the caudate nucleus and the lateral ventricle, they have intimate relationship. So we have a relationship between the caudate nucleus and the lateral ventricle. See the diagram. Now this is our, now we draw the diagram. Now this is our lateral ventricle, and we have the caudate nucleus here. So caudate nucleus is present like this. So the yellow color, what I shaded, no, that is our caudate nucleus. Now this is anterior horn, this is central part, and this is the inferior horn. Now where you see the caudate nucleus in relation to lateral ventricle? For anterior horn and the central part. Now see the caudate nucleus. Caudate nucleus in the floor. This is roof and this is floor. So in the floor of anterior horn and central part, we see caudate nucleus. Fine. Now see the inferior horn. Now inferior horn, the caudate nucleus, it is not in the floor. It is present above the floor. That is in the roof. Very good. For inferior horn, the caudate nucleus, in the roof of inferior horn, we see the tail of caudate nucleus. Please don't forget this. Okay, very important, and very often we are getting this question. Okay, now see the diagram. Now this is our anterior horn. Okay, and this is the central part, and this is the head of the caudate nucleus, and this is the body of caudate nucleus which is in the floor, and tail of caudate nucleus is forming the roof. Okay, right. So now we're going to see the relation of the individual horns, the individual parts of lateral ventricle. Again, if you remember some basic relation, that is enough, more than enough. They're not asking that much detail from these areas. Now the anterior horn. Now this is the anterior horn. So see the diagram. Now in the diagram, we taken the coronal section. Brain is here, and we taken the coronal section in the coronal plane. Okay, right. Now this is our anterior horn. So this is our anterior horn. Okay. Now above the anterior horn, the roof of the anterior horn, this is roof. What is that? That is our corpus callosum, just containing the two cerebrum. So the roof of the anterior horn. So anterior horn relation, in the roof, we see the corpus callosum. Corpus callosum. Strictly speaking, the body of the corpus callosum. Okay, corpus callosum, body of corpus callosum. Now in the medial wall, we see one septum here. What is that? That is the septum pellucidum. So in the medial wall, so actually we have the septum pellucidum like this. Septum pellucidum will be covering like this. So in the medial wall, we have septum pellucidum. That is our septum pellucidum. Actually, we remove the septum pellucidum and then only we are seeing the lateral ventricle. So septum pellucidum. So in the medial wall, we have septum pellucidum. Okay, sir. Now in the floor or lateral wall. Now can you see the small nucleus here? Yes, that is our, just now I told you, caudate nucleus. Very good. Now in the floor or lateral wall, we have caudate nucleus. Now this is the relation of the anterior horn. So roof, the body of corpus callosum, medial wall, septum pellucidum. In the floor or lateral wall, and in the floor or lateral wall, we have caudate nucleus. Clear? Next, the central part. Central part, again, the relations are very simple. Now again, this is central part. This is central part. The central part is starting from the interventricular foramen of Monro, from here up to the splenium of the corpus callosum. Up to here. Up to the splenium of the corpus callosum. The central part which extends from interventricular foramen of Monroe to splenium of corpus callosum. Okay, right. Now, what is the relation? Now, in the roof, what we have? Now, this is roof. That is a body of corpus callosum. So, roof, body of corpus callosum. Okay, and in the floor. Now, in the floor, I told you already, we have caudate nucleus. We have caudate nucleus. Now, apart from caudate nucleus, now we also see these structures. I am marking this as number 1. This is number 2. What is number 1 and 2? Now, in the floor, we also seeing fornix. And we also see number 2, that is thalamus. And we also see thalamostriate veins. Thalamostriate veins. Okay. So, now in the floor of the central part, we have caudate nucleus, fornix, thalamus, and the thalamostriate veins. Clear? Right. Now, next one. Now, what about the relation of posterior horn? Now, we draw one diagram. Now, this is our corpus callosum. Okay. So, this is the corpus callosum. And just remember the parts of corpus callosum. This is the genu of the corpus callosum. This is body of the corpus callosum. And this is splenium of the corpus callosum. And this is our cerebrum. Okay. Our cerebrum will be like this. So, cerebrum, yes, which is connected by the corpus callosum, right side and left side. Right. Now, from the genu of the corpus callosum, we have a fiber. That is our forceps minor, which is extending into frontal lobe. That is forceps minor, which is extending into frontal lobe. This is anterior and this is posterior. Now, from the splenium of the corpus callosum, now we have forceps major. Now, this is forceps major. So, forceps major, it is coming from the splenium of the corpus callosum, which extend into which lobe? Occipital lobe. So, posteriorly, we have occipital lobe. Now, in the occipital lobe, we have a part of lateral horn, and that is the posterior horn of the posterior horn of the lateral ventricle. Okay, right. Now, from the body, we have tapetum fibers. So, I'm marking tapetum fibers from the middle only. So, the tapetum fibers will come like this. Now, this is a fiber called tapetum fiber, which is coming from the body and also the small parts of splenium. Now, this is medial and this is lateral. Now, that's all over. The relation of posterior horn is over. Now, posterior horn, it is the horn in the occipital lobe. Okay. And this is roof and this is lateral wall. Now, in the roof and the lateral wall, what we have? In the roof and the lateral wall of posterior horn, we have tapetum fiber. Okay. Now, what about the medial wall? Now, in the medial wall, the forceps major, it is giving some elevations. Now, this is the elevation in the posterior horn due to the forceps major. So, medial wall, we have an elevation due to forceps major. Okay. Now, see the relation. Now, in the posterior horn, the roof and the lateral wall, we have tapetum. Now, in the medial wall, I told you one elevation. That is the elevation due to forceps major. And we also have elevation due to calcarean sulcus, and that is called calca revis. So, in the medial wall, we see two elevations. What are those? Number 1, the bulb of the posterior horn and the calca revis. The bulb of posterior horn, it is due to forceps major, and the calca revis is due to calcarean sulcus. Okay, right. Now, one last part is our inferior horn. Inferior horn, I told you already. Now, in the inferior horn, which is the extension into the temporal lobe. Very good. In the roof, what we have? We have the tail of caudate nucleus. Very good. Now, in the floor, what we have? In the floor, we have hippocampus. In the floor, we have hippocampus. So, hippocampus, it is forming the floor of the inferior horn. Okay. So, inferior horn, roof, tail of the caudate nucleus, and in the floor, we have hippocampus. That's all about the relations of the various parts of lateral ventricle. Okay. Right. Now, next, we're going to start third ventricle. Now, we're going to discuss the third ventricle relation. See, third ventricle, it is the cavity of diencephalon. I hope you remember. Third ventricle, it is the cavity of diencephalon. It is a cavity of diencephalon. Okay. Right. So, now, third ventricle relations. See, please remember, third ventricle is the midline cavity. Is the midline cavity. Okay. So, now imagine this is third ventricle. This is the midline cavity. Now, just lateral to third ventricle, we have diencephalon. I told you third ventricle is a cavity of diencephalon. So, it's a cavity, a midline cavity of diencephalon. And lateral to third ventricle, we have thalamus and hypothalamus. Okay, thalamus and hypothalamus. So, lateral to third ventricle, we have lateral wall of third ventricle is made up of what structure? Thalamus and hypothalamus. Clear? Now, this is the interventricular foramen of Monro. Now, from which the CSF from the lateral ventricle, it is coming to the third ventricle. So, I'm putting dots now. Yes, that is our third ventricle. So, imagine this is a diencephalon. Now, my palm, each palm, right and left side, that is the diencephalon. Now, between the two palm, you are seeing one small space here. You are seeing one small midline slit, and that is the third ventricle. So, now, third ventricle, now we taken section in the sagittal plane. We taken this section in the sagittal plane, and in the lateral wall, what you see? Yes, thalamus and hypothalamus. In the lateral wall, we have thalamus and hypothalamus. Okay? Is that clear? Right. So, now we remove the third ventricle. Now, this is the front side, anterior. This is back side, posterior, and this is floor. Now, what is in the anterior wall of the third ventricle? Now, in the anterior wall of third ventricle, we have three structures. What are those? Now, in the anterior wall, we have this structure that is nothing but anterior columns of fornix. Anterior columns of fornix. Next one, anterior commissure. And then lamina terminalis. So, now in the anterior wall, we have three structures. In the anterior wall, we have three structures. Anterior columns of fornix, anterior commissure, and lamina terminalis. We have three structures in the anterior wall of the third ventricle. Okay. Now, lamina terminalis, we're going to write. Lamina terminalis is a remnant of cranial neuropore. I told you, cranial neuropore in the development of neural tube, which you close by 25th day. Yes. So, the lamina terminalis, it is formed at the site of closure of cranial neuropore. So, lamina terminalis, it is the remnant of cranial neuropore. It is a remnant of cranial neuropore. Okay, right. Now, next one. Now, lamina terminalis, one more point. Lamina terminalis is not having blood-brain barrier. So, lamina terminalis, blood-brain barrier is absent. No blood-brain barrier. So, no blood-brain barrier means we know the name that is called circumventricular organ. That is circumventricular organ. Circumventricular organ. Clear? Right. So, these are the three structures forming the anterior wall. The anterior wall, we have anterior columns of fornix, anterior commissure and the lamina terminalis. Lamina terminalis, 2 points to remember. Lamina terminalis, remnant of cranial neuropore and no blood-brain barrier. So it is a part of circumventricular organ, no blood-brain barrier. Okay, right. Now in the posterior wall, we have pineal gland, and in the superior lamina of the pineal gland, we have habenular commissure. This black round I am drawing, no, that is the habenular commissure. In the inferior lamina of the pineal gland, we see posterior commissure. Right. Now, please write. The posterior wall, we have pineal gland. Now, in the superior lamina of the pineal gland, we have habenular commissure. Habenular commissure. Now, in the inferior lamina of the pineal gland, we have posterior commissure. This is in the superior lamina of the pineal gland and in the inferior lamina of the pineal gland, posterior commissure. Now, just below the pineal gland, now what is this? This is the midbrain. Now, midbrain, we are seeing dorsal part of midbrain. So, dorsal part of midbrain, I told you already, we have 4 swellings, 2 superior colliculus and 2 inferior colliculus. So, in the case of the pineal gland tumor, which compress which part? The dorsal part of midbrain. And that syndrome is called paranoid syndrome. Okay. So, please remember, please write, note, the tumor in the pineal gland, which compress the posterior part, the dorsal part of midbrain, or posterior part of the midbrain, and that syndrome is called paranoid syndrome. Okay, right. Shall we proceed? Next, in the floor. Now, floor of the third ventricle. Again, floor third ventricle, it is quite difficult only, but no other go. You have to remember these structures. If you remember the floor of the third ventricle, now easily you can answer the interpeduncular fossa contents. Right. Now, floor of the third ventricle from anterior to posterior. The anteriormost structure is our optic chiasma. In the floor of the third ventricle, anteriormost structure is the optic chiasma, and then infundibulum and the pituitary gland, and then this one is the tuber cinereum, and TC. So, third structure, TC means tuber cinereum. It is a part of our hypothalamus. And then number 4, mammillary body. This is a swelling like a mammary gland. And then posterior perforated substance. Okay. And then tegmentum of midbrain. So these are 6 structures from anterior to posterior. Clear? Right. Now, these structures, they form the floor. I told you just now. The same structure forming the interpeduncular fossa contents. So please write, note, interpeduncular fossa contents. Interpeduncular fossa contents. I will show you, don't worry, we're discussing the brainstem. Meanwhile, please write interpeduncular fossa contents. It is same as the floor of third ventricle, except your first structure and the last structure, except first and last. So, interpeduncular fossa contents same as floor of third ventricle, except first and last. Now, what is the first structure forming the floor? Optic chiasma. Very good. So, except optic chiasma, and the last structure, what is it? Yes, very good. Your tegmentum of midbrain. Last structure is the tegmentum of midbrain. Plus, one more change. We have to add one nerve. Which nerve? Oculomotor nerve. We have to add oculomotor nerve. So now, what are the contents of the interpeduncular fossa? Number 1, infundibulum. Number 2, pituitary gland. Number 3, tuber cinereum. Number 4, mammillary body. Number 5, posterior perforated substance. And number 6, oculomotor nerve. Now, see the diagram. Now, in the diagram, the contents of intrapedunculaar fossa. Number 1, infundibulum, and then pituitary gland, and then tuber cinereum, and then mammillary body, posterior substance, plus one nerve, which nerve? Oculomotor nerve, third nerve. Okay, so that's all about the relation of the third ventricle. Now we're going to see the animations for the CSF and ventricles, right? So now see the cerebrum, right? Now we're going to remove the cerebrum, and we are seeing this gray color, that is the cavity inside the cerebrum, that is our lateral ventricle. Okay, right. So now the lateral ventricle, which is connected to the third ventricle, yes, by means of one small opening, that is our, yes, foramen of Monro. So interventricular foramen of Monro communicate the lateral ventricle to the third ventricle. And we are also seeing the fourth ventricle here. Okay, so these are the ventricles we have: lateral ventricle, third ventricle, and the fourth ventricle, right? So now we are seeing the communications, right? So now first one, that is the interventricular foramen of Monro, which connect the, yes, the lateral ventricle and the third ventricle. Now next one, the third ventricle and the fourth ventricle, yes, they are connected by means of the cerebral aqueduct of Sylvius, that is not visible in this diagram, so that we are turning the brain, yes, so that we are seeing this, that is our cerebral aqueduct of Sylvius. Okay, so cerebral aqueduct of Sylvius connect the third ventricle to the fourth ventricle. Cerebral aqueduct of Sylvius, it is a cavity present inside the, very good, midbrain. That is a cerebral aqueduct of Sylvius. Right. Now next one, we're going to see the fourth ventricle. Two apertures we have. One is foramen of Magenti and another one is foramen of Luschka. Now that is our foramen Magenti. That is a median aperture, and we also seeing the lateral aperture. That is our, yes, foramen Luschka. Foramen Magenti and foramen Luschka, through which the CSF from the fourth ventricle communicating with the subarachnoid space. Right. So now we have removed all other structures, so that we are seeing the ventricles cavity. See here, so beautiful animation. No, we are seeing only the ventricles. We removed all other parts. So this is the entire picture, the clear picture, three-dimensional picture of our ventricles. See, C-shaped cavity you are seeing, diencephalon cavity, third ventricle you are seeing, and then the fourth ventricle. Right. Now we're going to see the relations of these ventricles. Right. Now first we're going to see the relation for our lateral ventricle. Now lateral ventricle, we know the parts. The one which is present in the frontal lobe, that is our anterior horn. And we have the central part. And we also having this part, that is the, yes, our posterior horn. And the one which is in the temporal lobe, that is our, yes, our inferior horn. Central part, anterior horn, posterior horn, and the inferior horn. Yes. Now we're going to see the relation for these parts of our lateral ventricle. So first, to begin with, we're going to start the relation of our anterior horn. Now see here, that is our anterior horn. Now in the front of anterior horn, yes, we are seeing the parts of our corpus callosum. What are those? Our genu of the corpus callosum and the rostrum of the corpus callosum. These two structures are present in front of the anterior horn. Now this is the anterior horn. Just above, you are seeing this one, that is our body of the corpus callosum. Now in the floor, we are seeing the, yes, the head of the caudate nucleus. These are the relations for the anterior horn. Okay. So in the floor, yes, you are seeing the head of the caudate nucleus. Now next, we're going to see the relation for the, yes, the central part of our, yes, our lateral ventricle. Now again, in the roof, we are seeing the, yes, the corpus callosum, body of corpus callosum. And in the floor, yes, we are seeing the caudate nucleus. We are having other relations also, but we are seeing some main relations in the animation. Okay. Right. So now, yes, the central part of lateral ventricle relation over. Now next, we're going to see the, yes, the inferior horn relation. Now the inferior horn, see the roof. The roof is formed by, very good, the tail of the caudate nucleus. Okay. Right. Now in the floor, yes, we are seeing this structure, that is a hippocampus. So the floor of the inferior horn is formed by our hippocampus, and the roof of the inferior horn is formed by our, yes, our tail of the caudate nucleus. Tail of the caudate nucleus, roof, floor, hippocampus for this inferior horn. Now these are some main relations of our lateral ventricle for the anterior horn, central part, and the inferior horn. Okay. Right. So now next we're going to see the relations for, yes, third ventricle. So now, yes, we removed the lateral ventricle. Now we are seeing the, yes, the third ventricle. Now we're going to see the relation of third ventricle. For this we removed the third ventricle and we are seeing this. Okay. Yes. That is the thalamus and the hypothalamus. So thalamus and hypothalamus, yes, see here, that is the thalamus and the hypothalamus. They will form the lateral wall of the, yes, lateral wall of our, yes, third ventricle. Okay. Thalamus and hypothalamus, they are the lateral wall of the third ventricle. Okay. Right. So now below that, again you are seeing the hippocampus. We have seen so many times. Again hippocampus connected to the one small structure there, that is our mammillary body, yes, by means of fornix. We know the detail. All right. Now we're going to see the, yes, anterior relation of the third ventricle. Now the anterior relation is formed by three structures. Yes, we're going to give the number as 1, 2 and 3. Yes. Now number 1, which we're going to mark, that is our anterior columns of fornix. So number 1, number 2 and number 3. So number 1 is our anterior columns of fornix. Number 2, anterior commissure, and number 3, that is our lamina terminalis. That is our anterior columns of fornix, anterior relation, and we are seeing the one small dot there, no? Yes, that is our anterior commissure. Yes, the small green dot, anterior commissure, and next you are seeing the lamina terminalis. Yes, that is our lamina terminalis. These three structures will form the anterior wall of the third ventricle. Now, what is the posterior wall, sir? In the posterior wall, you are seeing one main gland there, that is our pineal gland. In the superior lamina of the pineal gland, you have the habenular commissure. In the inferior lamina of the pineal gland, you see the posterior commissure. Now, these three structures, they will form the posterior relation of the third ventricle. Now, we're going to see the floor of the third ventricle. We're going to see from anterior to posterior. Now, the anterior most structure forming the floor is, yes, that is our optic chiasma. See there? Yes, that is a marking, green color you are seeing, no? That is optic chiasma. Then our infundibulum. Below the infundibulum, you are seeing the gland there, that is our pituitary gland. Okay. And then tuber cinereum of the hypothalamus. And then you are seeing the round swelling there, that is our mammillary body. And then posterior perforated substance we are not able to see, and then we are seeing the tegmentum of the midbrain. These are structures from anterior to posterior, that is our optic chiasma, infundibulum, pituitary gland, tuber cinereum of the hypothalamus, then mammillary body, posterior perforated substance we are not able to see, and you are seeing the tegmentum of the midbrain. These are structures forming the floor of the third ventricle. These are some important relations you have to know for the third ventricle. So that's all about the relations. Now we're going to discuss one last topic in this module. That's our fourth ventricle. Okay. Now fourth ventricle, it is a cavity of metencephalon and the myelencephalon. See, metencephalon form pons and cerebellum, and the myelencephalon forms medulla. So between pons, cerebellum and medulla, we have fourth ventricle. Clear? Right. Now, what is the relation? See, relations, mainly they will ask you the roof and floor. That's all. Now, this is the roof and this is the floor. Now, who is forming the roof? Now, roof is formed by, so general outline is the roof is formed by cerebellum. Okay, so cerebellum is forming the roof. That is the roof of the fourth ventricle. But sometimes they ask you specifically. Now below the cerebellum, we have two sheet. Now velum means sheet. Velum means sheet. Okay. Now below the cerebellum, we have superior medullary velum, and this is our inferior medullary velum. That is our inferior medullary velum. This one I am saying. So this one is our inferior medullary velum. So roof is formed by cerebellum. That is more than enough. Sometimes they may ask you this. Okay, so please remember, now below the cerebellum we have two structures. We have two sheet, superior medullary velum and inferior medullary velum. So superior medullary velum, it is the nervous tissue. It is the nervous tissue. And inferior medullary velum, it is a non-nervous tissue. It is the non-nervous tissue. Okay, right. Now, who is forming the floor? Floor is formed by pons. Okay, floor is formed by pons and medulla. Okay, so floor is formed by the posterior surface of pons and medulla. Okay, right. Now, next we're going to draw the floor of the fourth ventricle. So the floor of the fourth ventricle, we're going to draw a line diagram. The floor of the fourth ventricle is a diamond shape or the rhombus shape. Okay. So this is the floor of the fourth ventricle. Now the floor of the fourth ventricle is formed by the posterior surface of pons and the posterior surface of the upper medulla. Posterior surface of upper medulla. Okay. Okay. Do we have any structure between pons and medulla? Yes, we have one structure. The structure is called stria medullaris, which is running transversely between pons and medulla. So the structure what I drawn there, it is called stria medullaris. Fine. Now, in the center of the fourth ventricle, we have median sulcus. Now this is our median sulcus. Now median sulcus, on the lateral side of the median sulcus, we have sulcus limitans. On the lateral side, we have sulcus limitans. Now this is sulcus limitans. Now the sulcus limitans, in the upper part of sulcus limitans, now this is our sulcus limitans. The upper part of sulcus limitans, which expand and form superior fovea, which forms superior fovea. Now, in the superior fovea, we have one pigmented structure, a bluish gray pigmented structure, and that is called locus ceruleus. So, locus ceruleus, it is the bluish gray pigmented structure which is present at the superior fovea. Okay. Now, the locus ceruleus, which contains dopamine, which secrete the neurotransmitter dopamine. Okay. Now, here in the lower part of sulcus limitans, we have inferior fovea. That is inferior fovea. Now, from inferior fovea, yes, we have one small triangular extension. Okay. And we're going to extend this. So now, we got the outline of the fourth ventricle. Now, in this fourth ventricle outline floor, we see numerous nucleus, the cranial nerve nucleus, and we also see some round projections. Now, next thing, we're going to draw that only. Now, in the posterior surface of pons, in the floor of fourth ventricle, we see one round elevation, and that is called facial colliculus. I told you already, any round swellings are called facial colliculus. Now, facial colliculus is due to, now what is the nucleus present inside the facial colliculus? We see later. So now, you please remember, facial colliculus, it is a round swelling which is seen in the posterior surface of the pons, in the floor of the fourth ventricle. Clear? Right. So now, facial colliculus, it is seen in the floor of the fourth ventricle in the posterior surface of pons. Now come to the posterior surface of upper medulla. In the floor of fourth ventricle, we have two triangles. What are those? Now we have hypoglossal triangle. I am going to mark this as A and I am going to mark this as B. So what is A and B? So A and B are two triangular areas seen in the posterior surface of upper medulla. Now A is the hypoglossal triangle. A is the hypoglossal triangle and B is the vagal triangle. Vagal triangle. So hypoglossal triangle contains hypoglossal nucleus. Vagal triangle contains vagal nucleus. Very, very important. Hypoglossal triangle above, vagal triangle below. Very important. Now the area below the vagal triangle, we have one small area called area postrema. Now area postrema, it is the chemoreceptor trigger zone. Is the chemoreceptor trigger zone. Okay, so chemoreceptor trigger zone means center for vomiting. Center for vomiting. Okay, right. Now last point, again area postrema does not have blood-brain barrier. So no blood-brain barrier. It is a part of circumventricular organ, area postrema, below the vagal triangle. Okay, right. Now one more triangle we have at the junction of pons and medulla. Now can you see this one? At the junction of pons and medulla, we see this triangular area, that is our vestibular triangle. So vestibular triangle which contains vestibular nuclei. Okay, right. Now last point. Now facial colliculus. See facial colliculus, the name itself you have a clue. Colliculus means round swelling. And this colliculus is due to facial. So axons of facial nerve. Now this is our axons of facial nerve which gives one round elevation, and that is called facial colliculus. That is our facial colliculus. That is our facial colliculus. Okay. Now inside the facial colliculus, we see one nucleus. Which nucleus? Abducent nucleus. So sixth nerve nucleus, it is present inside the facial colliculus. So abducent nucleus, please underline, which is present inside the facial colliculus. Okay, right. Now damage to facial colliculus. What is the first structure to get affected? So now damage to facial colliculus. See, damage to facial colliculus means what is the first structure affected? Facial nerve axons. The injury is very deep, then it affects the axons of facial nerve and also the sixth nerve nucleus. Okay, so damage to facial colliculus which affect the axons of facial nerve greater than sixth nerve nucleus. Now damage to facial colliculus, which group of muscles affected? Facial muscles affected. Facial muscles affected greater than lateral rectus muscle. Lateral rectus muscle. Okay, so 3 times we got this question. 2022 INCET we got this question. Okay, now shall we proceed? Yes. Last point is, now we're going to list out the nucleus present in the floor of the fourth ventricle. Okay, now in the floor of the fourth ventricle we have sixth nerve nucleus, number 1, eighth nerve nucleus, vestibular nucleus, and then hypoglossal nucleus and vagal nucleus. Clear? Right. Now which nucleus is not present? Again, one time we got this question. Please put one box and then write, note, facial nucleus is not present in the floor of fourth ventricle. Is that clear? Right. So by this, we are completing the fourth ventricle. This is a very big module. So we started with the circulation of CSF and we discussed the subarachnoid system and then lateral ventricle, third ventricle, and finally fourth ventricle. Okay, right.